Today, we're going to go deep right inside the gastrointestinal tract to investigate a really common but, often misunderstood condition, peptic ulcer disease.
Welcome to SurgiSmart, where we cut to the core of surgical topics. I'm Major Munish Chauhan, a general surgery registrar in the British Army. And in this first part of our investigation, we are going to focus on what actually causes peptic ulcer disease and the science behind it.
You know that feeling, right? That burning, kind of gnawing pain deep in your gut? What is actually going on in there? What's really causing that damage? Well, let's play detective and find out. So, any good investigation has to start at the scene of the crime. For us, that means getting a handle on what a peptic ulcer actually is, deep down inside the body. Okay, so a peptic ulcer isn't just a minor irritation. We're talking about a literal break, a deep sore, in that protective inner lining of your stomach or your small intestine. And here's the key part. It goes deep, right into the muscular layer of the wall. That's what makes it so serious. Now, one of the first clues a doctor is going to look for is timing. It's all about the timing of the pain. If it's a gastric ulcer right there in the stomach, the pain often hits you almost immediately after eating. We're talking within about 30 minutes. But if it's a duodenal ulcer, which is a bit further down, the pain is delayed. It might not show up for a couple of hours, or it might even wake you up in the middle of the night. All right, we've surveyed the crime scene. Now it's time to line up the usual suspects. So who or what is really responsible for all this damage? Well, as you can see, this case is pretty much dominated by two main culprits. First up, we've got a bacterium called Helicobacter pylori. This little guy is responsible for a staggering 75% of cases. The second most common cause, at 20%, is the use of NSAIDs. That's non-steroidal anti-inflammatory drugs. Honestly, between the two of them, there's not much room for any other suspects. Now, of course, there are other potential triggers, but they are way less common. Things like other medications or the intense physical stress your body's under from a really severe illness or injury. Even smoking can play a role. And then you have some really rare conditions like Zollinger-Ellison syndrome. But for our investigation today, we're laser focused on the big two, H. pylori and NSA. So we know who our suspects are, but how do they actually pull off the crime? I mean, how do they get past the stomach's incredibly tough natural defenses? The best way to get your head around this is to think of your stomach lining as a fortress wall. It's constantly under siege. On one side, you have these powerful attackers, like your own stomach acid. And on the other, you've got this really sophisticated defense system, all designed to protect that wall. An ulcer forms when that battle is lost, when the destructive forces completely overwhelm the protective ones. On the defensive side, you've got a thick layer of mucus, you've got bicarbonate to neutralize acid, and these crucial chemicals called prostaglandins. But the attackers, they are powerful. You've got stomach acid itself, and of course our two prime suspects, H. pylori and NSAIDs, and their whole game plan is to dismantle these very defenses. H. pylori is incredibly well-equipped for this attack. It's like a tiny super spy. First, it pumps out this enzyme called urease to create a little protective, neutral bubble all around itself, which shields it from the stomach acid. Then, it uses its little tails, its flagella, to literally swim right through the mucus barrier and latch onto the fortress wall. And once it's there, it releases toxins that directly damage the cells and stir up inflammation, creating a breach in the wall. Now, NSAIDs, our second suspects, they work differently. They're more like saboteurs. They block the production of those all-important prostaglandins were mentioned. And without prostaglandins, the fortress just can't make enough protective mucus or bicarbonate, and even the blood flow gets reduced. The wall just gets weaker and weaker, leaving it totally vulnerable to attack from stomach acid. Okay, so with the defenses breached and the wall damaged, the body starts sending out distress signals. Let's take a look at the telltale clues, the signs and symptoms that an ulcer has actually formed. The classic sign, of course, is that upper abdominal pain. But the body sends out other signals too. Things like bloating, feeling full way too quickly, nausea, or unexpected weight changes. The more alarming signs, though, are the ones that point to bleeding, like melena, which gives you dark, tarry stools, or in really severe cases, hematemesis, which is actually vomiting blood. Now, it is absolutely crucial to know the difference between those common symptoms and what we call alarm symptoms. These are the red flags. These signal a need for immediate medical attention. We're talking about things like losing weight without trying, finding it harder and harder to swallow, any obvious bleeding, persistent vomiting, or signs of iron deficiency anemia. These should never be ignored.
Okay, let's pull all our findings together and close out the case file for this part of the investigation. Let's summarize the key evidence. First off, this isn't some rare, bizarre medical mystery. The lifetime risk of developing a peptic ulcer is between 5 and 10%. That means as many as 1 in 10 people will deal with this in their lifetime. That makes it a major global health issue. So at the end of the day, a peptic ulcer is really just the physical evidence of an internal battle being lost. It's a sign that the damaging forces have finally broken through the stomach's protective lining. Everything we've talked about really just boils down to that simple but absolutely critical imbalance. So we've identified the suspects, and we've figured out their methods of attack. But that's only half the story, isn't it? The next big question is, how do we prove they're actually there? And more importantly, how do we stop them and help the fortress rebuild its walls? We'll dig into all of that in part 2.